This next section is to talk about really two things. One is the research questions. And as we're going through it, maybe you should start thinking about in your mind, what do you think the implementation research questions are whenever you're doing any kind of research? And I know many of you are professors and teach. When you're teaching students, I know that for me, a lot of times the question is, what's your research question, right? That's where we start. We want to understand what's the question. And so I'm going to talk a little bit today about what are the types of questions that we ask with implementation research. And then some guidance on specific aims. Now, specific aim is a term that we use in the United States, particularly when we're writing research grants for the federal government, right? And it's essentially the summary of what we're trying to do in a particular study. In our research grants, we usually get one page where we write the specific aims, where we give a little bit of background, the goals of the research, and a little bit about the approach. And I realize that you may not have that same exact format as you're developing your proposals. However, I think that the fundamental pieces, and I check this out with our WHO colleagues, the fundamental pieces about the research questions and the approach, et cetera, that those are the same. And so I think it can be useful. So there are a number of different types of dissemination implementation research questions. One of them, and this may be one that you are first focused on. So in fact, when you're realizing that there's a gap between research and practice, one of the first things that comes to your mind is, why is there a gap? And so implementation research almost always includes questions about the factors that are influencing that gap. And that gap may occur at a number of different levels. It may occur at the adoption phase. Why aren't organizations, communities, schools, municipalities, why aren't they adopting a particular evidence-based intervention? It may happen at the implementation stage. Maybe people are willing to adopt, but it's not actually getting used, or it's not getting used as planned. Or it may be in sustainability. Maybe there is adoption and implementation, but it's not being sustained over time. And so asking the question about why that's happening, questions about factors influencing adoption, implementation, and sustainability is a very common type of research question in implementation research. Another one that is associated with this, right, but I would say a bit more academic, is testing of models or frameworks in implementation science. So in particular, under this category are those models and frameworks that describe determinants of implementation. And you'll hear a little bit more tomorrow about how we categorize different models and frameworks in implementation science. But those determinants frameworks are those ones that describe the factors that may influence implementation. And so some research in implementation science is actually testing those models and frameworks, and in particular, the relations between the various constructs that are included in those models. But in general, this larger bullet, questions about factors influencing implementation, is an important one and a very common type of research question. And other types of research questions, and this first one in this slide is probably one of the ones that I think is the most important in implementation research. And it's questions related to the development and evaluation of strategies or groups of strategies to increase adoption, implementation, and sustainment. So obviously, implementation science is about ways to increase the use of evidence. And how we do that, the strategies that we use, and whether or not particular strategies work to increase adoption, implementation, and sustainment is probably the most critical piece of implementation science. Then there's also questions related to scale up and spread and questions related to sustainability. So these are just broad categories of types of research questions. You may be thinking about where do the questions that you have that you may develop a proposal around, where do they lie? Are they about the factors that influence adoption implementation? Are they about the testing of specific strategies to increase implementation? Are they about scale up, sustainability? Are they a combination of these? So other comments about key implementation research questions. So I talked about the first one. The second one, what are the most effective techniques or strategies to improve the distribution and use of evidence or to incorporate new discoveries into practices in care delivery or in public health? How do contextual factors influence implementation success or failure? And how can contextual factors be modified to increase chances of success? And when we talk about contextual factors, I know right now that might be vague, but when we talk about theories and frameworks tomorrow, you'll see a lot of examples of contextual factors. What we mean by that is things in the environment or the context of where something is going to be implemented that could influence implementation success or failure. And then there's also questions around techniques to de-implement practices that are no longer effective. We also have questions related to sustainment. Why do established programs lose effectiveness over time? And what factors might influence longer term sustainability? And how can sustainability and health maintenance be achieved? So what techniques can we use? What strategies can we use to enhance sustainability? So I know that some of you may be interested in policy implementation, and there's a number of really nice papers that we will have available for you about policy implementation. A recent one by Karen Emmons that I think is quite useful. But there's a number of policy implementation research questions, such as what specific policy or intervention was put in place by implementers in order to address the non-communicable disease issue being tackled? To what extent was it implemented as intended? Was it adopted? Was it sustained? What factors influenced how well a policy was implemented? And what was this, what's the association between that implementation or level of implementation and the effectiveness outcomes, such as population health? And what was the approach of implementation that was used? Was it cost effective? I'm not going to go over this too much, but I wanted to just point out that there is an article that we have posted in the share drive that describes the various objectives for implementation research, and then the kinds of questions and research methods and data collection approaches that may be useful. So I'm just going to cover a couple of them. Oftentimes when you notice that a gap is there, and when I say gap, I'm talking about a research to practice gap, that something exists, some practice, policy, program, intervention exists, but it's not being used in practice. You don't know why. And so you want to explore, you're in the explore phase, and you can ask these questions. What are the possible factors and agents responsible for implementation of a health innovation, for enhancing or expanding a health innovation? And you may use these types of qualitative methods or some analysis, network analysis, combining mixed methods that we talked about before. You may be in the explore phase, where you're identifying or describing a phenomenon as it's happened. So this can happen in retrospect, right? Retrospectively. What happened in a given implementation effort and how can we learn from that? And then you have several different approaches to and research methods here to test whether a particular strategy works to produce the expected outcome in implementation. I'm going to just skip this. You should feel free to look at it yourselves. This is another, I think, useful graphic for locating yourself on what type of research that you're doing and to ensure that, in fact, you are thinking about implementation research and not some other kind of research. So this is a locating yourself on a subway line, a useful article that sort of describes this efficacy research, effectiveness research, and implementation research through these different colors. And I'm not sure if the colors are coming across clear to you, but this sort of green or teal color, you have an intervention or practice of interest, or the innovation here. And you ask, has the intervention or practice of interest shown efficacy? If it has not shown efficacy, then the type of research that is probably the most relevant is efficacy research. And then if it has, then you're really on the path to trying to understand whether you're doing effectiveness research, a hybrid, or an implementation research. So has the intervention or practice of interest shown effectiveness? So remember, if efficacy is in a controlled environment, effectiveness is more real world. If not, then you're probably trying to still answer the question, does it work? If it has, then you're probably doing implementation research to see what methods or strategies can be used to increase its adoption and implementation. And there's a number of different types. You might be doing studies to understand context. You might be designing implementation strategies, and you may be testing implementation strategies. If the answer to the question of has the intervention or practice of interest shown effectiveness is, well, sort of, or maybe a little bit, then you're probably doing a hybrid effectiveness implementation trial where we're doing both. I wanted to introduce you to this topic of the logic models for implementation research. So again, I'm not going to go into depth on these logic models, but this is from J.D. Smith. And we actually have the article listed. This reference is from the preprint, but we have the article. We should have the article available for you. If not today, we will by tomorrow. And this logic model shows, if you look at it, shows the outcomes, and we're going to talk a little bit more about outcomes a little bit later, but the outcomes of implementation research, or of implementation, right? Reach, adoption, maintenance, acceptability. And over here are, on the very left, are factors that may prevent or enable improvements. And oftentimes you can identify these from frameworks, models or frameworks. And those of you who are familiar with models and frameworks in implementation science may recognize that these are from the Consolidated Framework for Implementation Research, which is a framework that we will cover tomorrow. And so we look at interventions and on the systems, right? The strategies, implementation strategies that influence whether an intervention is adopted, implemented, and maintained. And there are a number of different types of strategies that we can use to make that happen. And so here is an example of some of the strategies that are described in Byron Powell's work with expert recommendations for implementing change, which he will talk about. And then here in between those strategies and the outcomes is the mechanism for how we think that this might work. So again, I'm not going to talk too much more about this except to say that some people find that the logic models, implementation research logic models are an effective way of laying out how you expect particular strategies to influence implementation outcomes and what factors you think may be influencing implementation. I want to say something. I'm going to switch gears here a moment and say something about participatory research, community participatory research, and community engagement. So many of you probably already do this in your work, and it's certainly a foundational concept in our field, in the field of health promotion. Community-based participatory research, or community engagement more broadly, is an approach that emphasizes the dialogue between the community and researchers and co-ownership of research. This approach, this sort of foundational concept, cannot be overemphasized. It is critically important, I would say, for any type of research, but in particular for implementation research, because it includes stakeholders such as community organizations, community clinics, health centers, social service agencies, faith-based agencies, lay health workers, many of those people who are ultimately not only the recipients of the innovation, but also the implementers and the people that will be responsible for making decisions about adoption, about implementation, about sustainment. It's critical to include these people in your planning of your research. Even though community-based participatory research is really a whole field, but a process that it stands on its own and applies to any kinds of research, it's a natural fit with dissemination and implementation research. And there's a number of different reasons why. It can ensure that the scientific discoveries and innovations that you're trying to implement fit with the population that they were designed for, so that they can get widely used in practice and be sustainable. It can also help speed the dissemination of innovation as community partners and stakeholders disseminate to their networks, which may include other potential adopters and implementers of the innovation. And partners who adopt and implement the innovation can serve as role models to others considering adoption and of the innovation. So there are many, many reasons, these are just a few, that community engagement, community-based participatory research principles are very, very important in the field of implementation science. And I know many of you have expertise in this area, so that's great. And if you don't, on your teams, I would encourage you to include someone who has expertise in this area. I know this is a little bit difficult to see, but I just wanted to give you this so that you can, on your own, look at this framework and paper from Lucero and Wallerstein that talks about CVPR and recognizes that in CVPR, there are similar constructs and determinants that are critical for success in dissemination and implementation, and also should be considered for dissemination and implementation research. And those include attention towards the outcomes, the intervention in research design, the partnership dynamics, and the context in which you're working. I'm going to turn to advice for writing winning implementation research proposals. Much of this comes from a paper from Ross Brownson. There's a paper called The Magic Elixir that we have listed. This is another paper a little bit earlier that I think does a really nice job. And when writing proposals, it's useful, I think, to look at them from the perspective of the person who's going to be reading the proposal and making decisions about whether or not to fund you. And I understand that WHO has some resources that they're going to be able to support some research in these countries, in your country. But also there are other venues for getting support for implementation research. And one of the reasons I have Dr. Gillanetta to talk about some opportunities that are available through the National Institutes of Health, the US, And this is an unusual opportunity because it is open to investigators from other countries, recognizing that people in other countries can contribute greatly to the field of implementation science. So we'll talk about that. But in any case, when you're writing any type of proposal, it is useful to think about it from the person who's reviewing it. And so from that perspective, oftentimes the reviewer is trying to see if the applicant has done a number of things. So one is to state the general problem and the unique contribution. So it's critical to talk about the gap between research and practice, and how, and the goal of the research that you're going to be doing. And then to state realistic aims, typically in a logical order, but still independent of each other, using simple language to describe what will be accomplished, not necessarily how yet in this original, in the first page where you're describing your work, and then how you will accomplish your aims. And then summarizing the importance of the proposed study, its implications, and how it advance knowledge and improve health. In this paper, Dr. Brownson talks about writing winning implementation research proposals. And so he talks about 10 key ingredients that I'll go over briefly. The gap or need. You have to provide clear evidence that a gap exists, and it could be a gap in quality, a gap in adoption and implementation, sustainment. And the gaps could be measured at a population level, an organizational level, provider level. And then you have to talk about what is the evidence-based treatment or intervention or policy or program that needs to be implemented. Often it's important to demonstrate the evidence of that evidence-based intervention. As we mentioned, if you're doing a hybrid design, there could be variable levels of evidence, but there typically you need to establish that there is some evidence for that innovation. So what do we mean by evidence? Evidence-based interventions that's the thing that we're using Jeff Curran's language, the thing that needs to be adopted and implemented. And it typically has something with proven efficacy or effectiveness. But we know that to some degree, evidence is in the eye of the beholder, meaning that there are different levels of evidence. So perhaps the highest level of evidence is evidence-based interventions that have been recommended based on meta-analyses or systematic reviews of the literature, and where there are multiple studies that have shown the effectiveness of a particular innovation or intervention. The next level is interventions that are effective because they've been evaluated at least in one peer-reviewed study. Interventions that are promising, so there's a written program evaluation or some evidence of effectiveness, or innovations that are emerging. So depending on your situation and the requirements, you may have an innovation or intervention or policy that has varying levels of effectiveness. Okay, going back to the key ingredients. Having a conceptual model and theoretical justification is typically very important in an implementation research proposal, because this helps structure, gives structure and guidance to the factors that you're going to be focusing on, the measurement, how you will evaluate the program. Stakeholder priorities, engagement, and change. Do you provide evidence that there's an engagement process for stakeholders? A lot of times people provide letters of intent, but oftentimes that's not enough. You have to include stakeholders on your research team. And then, is the setting ready to adopt new services, treatments, programs? Do you provide information about the willingness to change? Is there any preliminary data about organizational policy contexts? And then what about the strategy or process? Do you clearly justify the strategies that you wish to use? Oftentimes, strategies are multi-level or multifaceted, and they have to be acceptable to stakeholders. Do you talk about your team? Who's on the team? Is it a multidisciplinary team that has experience and are able to carry out this implementation research study? Is what you're proposing in terms of the design and methods, and often I think one of the places where people struggle here is the timeline, underestimating the time that it takes to do a research study. But when reviewers are looking at a proposal, they're often looking at, is it feasible? Measurement and analysis. How will you answer the research questions? Have you chosen constructs that align with your theory and model? Do you have a measurement plan? How will you demonstrate success? And then what is in the context? Is there leverage or support for sustaining change? So the idea for this last one is that anyone can propose an implementation strategy that they want to test, but if it's not likely to be something that can be sustained within the environment, then it will have limited utility. And so this is another thing that it is important to include. This is a table from this article. This article is the one that's called the Magic Elixir for Developing Proposals. And it sort of has these different sections. As I mentioned before, they may not be exactly the same as in the proposal that you will be developing, but I think in most proposals you have clear aims and a rationale, the significance, how does it fill a gap? Why is it important? What impact can it have on patient or population health? How is this new or different than what's been done before? And of course, the approach. And there are a number of different things related to the approach. So this table is a good, I think, summary of those things. Okay, I want to have a little bit of time for questions. So I'm going to try to wrap this up here. So research questions, these are just some examples. What is the reach, effectiveness, adoption, implementation, impact, and maintenance of the proposed intervention? What is the intervention effect in clinical and county? Here, this is an example of one with colorectal cancer screening rates, where we used REAIM to look at as a framework for trying to understand the reach, effectiveness, adoption, and implementation of colorectal cancer interventions to increase screening. What is the level of organizational readiness at clinics? It's another research question. What contextual factors influence the level of implementation? What are mediators or moderators of adoption and implementation? And what organizational and contextual factors influence sustainability? So I'm just trying to give you an idea of different research questions. So to summarize, dissemination and implementation research questions include those related to factors influencing adoption, implementation, and sustainment of evidence-based programs, policies, and practices. Questions related to models or frameworks and relationships between those constructs, or predictors of implementation outcomes or measurement studies. The evaluation of implementation strategies, questions related to scale-up, and questions related to sustainability. So we know that successful D&I grant applications could include or should include attention to key ingredients, and granted, some of these are different from other types of grants. Some of them are the same. If you've written research grants before, you know that you have aims and you have an approach, et cetera. But D&I research can help us understand and intervene to accelerate the use of evidence and innovations to increase impact in research and health and quality of life. And I want to just end with reminding ourselves. I know we've been talking a lot about research. We've been talking about research questions, but the real purpose is to improve practice, improve public health. And so one of the things that I think is important when you're asking yourself, when you're developing research questions, is how will the answer to this question improve public health? How will it improve clinical practice? Sometimes it's a small question and it's only going to improve it a little bit incrementally, but you have to start somewhere. And sometimes it's a quite important and large question.